All right, so we're going to do the ankle evaluation test. First, we are going to get a sample or a past history and a present history. So that's sample or OPQRST, combination of both of those. And then we would check for swelling, discoloration, and deformity. No examples of that. Then we're going to do the bony palpations. First, the shaft of the tibia, and then the shaft of the fibula. And we're testing those for fracture. And then the dome and neck of the talus. So the neck's like right here and the dome's like right on top. It's hard to feel because it's a little deep. And that we are also testing for fracture. Then the lateral malleolus. Can you see it?
Mm-hmm.
And then the medial malleolus. And those are called the malleoli. And again, we're testing for fracture. And then we will palpate the bone or the soft tissues. So the anterior deltoid ligament, the mid deltoid ligament, and then the posterior deltoid ligament. And we're testing for tear or sprain. And then we would do the anterior tibial fibular ligament, which is in between the tibia and the fibula, so like right there, and we're testing for sprain. Then the lateral ligaments, so go ahead and rotate your foot. Thank you. We're testing for the ATF, the anterior talofibular ligament, then the CF, calcaneal fibular ligament, then the PTF, the posterior talofibular ligament. Then we would test for the peroneal tendons, just like right here, it runs up your foot. Go ahead and evert your foot, eversion. It's right here. Hard to see, but it goes along your foot. And then we would do the special function tests. So first we're going to do the squeeze test. And you don't want to do these tests too hard because we're checking for fractures, so make sure you're doing that. And that's the squeeze test is checking for the tibial fracture or fibular fracture. Then we would do the calcaneal bump test. So go ahead and relax your foot, and you just bump the bottom of their heel, and you're testing for fracture again in the tibial or fibular. And then we will do the stress test. So first we're going to do inversion. So we do plantar flexion and inversion. Go ahead. Plantar flex, inversion. And that is testing the ATF. Go ahead and then relax. And then go to 0 degrees, inversion, just inversion. That is testing the CF, the calcaneal fibular. Then dorsiflex and inversion. That is testing the PTF, the posterior talofibular. And then we do eversion. So again, plantar flex, eversion. Now that's testing the anterior deltoid ligament. Then 0 degrees, inversion or eversion. That's testing the mid deltoid ligament. Then dorsiflex and eversion, and that's testing the posterior deltoid ligament. And then we would do the anterior drawer test. So place a hand on the base and you grab the bottom of the heel like this, and you're going to do an upward motion like that. And you're testing the anterior talofibular ligament and the anterior deltoid ligament. And then the posterior drawer test, same thing, except instead of pulling up, you're pushing down. So, and that's checking the posterior talofibular ligament. And then we would do ROM, range of motion test, and you could do it actively or passively. I'm just going to have them do an active range of motion test. So if you want to give me the video so you can just be relaxed in doing that, go ahead and ankle dorsiflex. Ankle dorsiflexion, that should be around 20 degrees. Ankle plantar flexion should be around 50 degrees. Relax. And then ankle inversion, good. That should be around 5 degrees. Ankle eversion, Good, that should be around 5 degrees. And we just did it actively, so passively you would be moving the patient's foot for them. And then we would do the strength muscle strength test. So first we're going to do plantar flexion. So go ahead and bring your foot into dorsiflexion. Dorsiflex your foot. Okay, get a hand on the base and then go ahead and plantar flex, relax, plantar flex, relax, plantar flex, relax. And that is testing the gastrocnemius and the soleus and the tibial nerve. Then we would do dorsiflexion, so hand on the base, hand on his foot. He starts out in plantar flexion. Go ahead and dorsiflex. 1. Go ahead again. 2. 1 more. 3. Good. And that is testing the tibialis anterior and the deep peroneal nerve. And then we would do inversion. So hand on the base, hand on the foot. Go ahead. Start in inversion now. Good. 1, 2, relax. 3. Good. And that is the tibialis posterior and the tibial nerve again. And then now we're going to do eversion. Go ahead. Relax. 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 And that is testing the peroneus longus and brevis, and that is a superficial peroneal nerve test. And then we're going to do the neurological test. So we're going to test L4, which is ankle dorsiflexion and inversion. So go ahead and dorsiflex and then inversion, and that's testing L4 right here. And then go ahead and do toe extension, and that's testing T5. Go ahead and do ankle eversion, and that's testing, no, eversion.
Oh, eversion, my bad.
Yep, and that's S1. And then ankle plantar flexion, and that's testing S1 and S2. Sensory, so relax your foot. We're just going to do sensory. So L4 right here, L5 is right here, and then S1 on the side of the foot. On the lateral side, this is L4 is medial, L5 is the dorsum, and it's the web between the toes, and then S1 is the lateral side of the foot. And then we're going to do the S1 Achilles tendon reflex test. Make sure his Achilles tendon is intact. So go ahead and relax right here. See how his foot moves. All good. Go ahead and flip back over. And then go ahead. We're going to do some, you don't have to, you can go scoot back a little bit.
Okay.
We're going to do the blood flow test. So I'm going to check for his pulse. Good. Check for his pulse. You get his pulse if it's 15 beats over. You do it for 15 seconds. That's a heart rate of 60. And then you would test recapitalization test. So if they had painted nails, you'd have to do it on the other side. You just see if it recolorizes from white to red in under 2 seconds, and then you would compare bilaterally to the other ankle.